Hi, how are you doing today?
I'm good. How are you?
Good, thank you. My name is Amy, and I'm going to be the nurse doing your physical exam. So the first thing I'd like to do is just ask you what your name and date of birth are.
Cassandra Stevens, 11/26/84.
Good. Can you tell me where you are today?
Chamberlain Hospital.
Thank you. And who's the President of the United States?
Obama.
Thank you. So patient is alert and oriented ×3. Patient is appropriately dressed for the weather. She is well nourished with good personal hygiene. She is maintaining eye contact, answering questions appropriately, and has a pleasant demeanor. So at this point, I would take her vital signs, which would consist of her heart rate, respiratory rate, blood pressure, temperature, and her height and weight. They would all be assessed and within normal limits. So now I'm going to go ahead and just ask you about your pain. Are you in any pain today?
Well, I have like some numbness tingling.
Okay, sure. So when did that start?
It started this morning.
Okay, and where is it located?
Oh, in my fingers.
In your fingers? Okay. So is this constant for you, or does it come and go?
It's been constant.
It's been constant? Okay. And about characteristics, so how does it feel? Is it like pins and needles?
Exactly.
Okay. So is there anything that makes it worse? Any aggravating factors?
No.
Okay. Anything that relieves it or makes it feel better?
No, it's just continuing.
Okay. Is there a time of day that you notice that it's worse?
Well, in the evening.
In the evening? Okay, before you go to bed. And if we were going to rate this pain on a scale of 1 to 10, with 1 being no pain and 10 being the worst pain you've ever been in, where would you rate this pain today?
About a 5.
A 5? Okay. So the first thing I want to do is go ahead and just do a cardiovascular and a respiratory assessment. I'm going to listen to your heart and lung sounds. We're going to listen to your lung sounds first. Go ahead, just breathe normally. Go ahead and lift up your right arm. Good. And now I want to listen to your heart sounds of all 5 locations. We're going to listen aortic, pulmonic, Erb's point, tricuspid, and mitral. So I'm going to ask you just a couple more questions about your numbness and tingling that you're having in your hands. So do you have diabetes?
No.
No? Okay. Any problems with your blood pressure that you know of? Any medications that you're on for your blood pressure?
No medications. I'm not sure of any problems with
Okay.
blood pressure.
Have you noticed that you have any problem feeling hot or cold?
I did notice that.
Yeah? Okay, so which one can you feel hot or cold, or which one are you not feeling?
Okay, I can't feel hot.
You can't feel hot. Okay. So the next thing we're going to do is we're going to assess your deep tendon reflexes bilaterally.
Okay.
So I want to go ahead and do this first one. Just go ahead and try and relax your hand as best as possible. Good. Other side. Good. And then we're going to go ahead and do our next reflex. I'm just going to move around the back of the bed. It'll actually be easier for me. Good. And the other arm. This is our tricep reflex. We just did our bicep reflex before. And now we're going to do our brachioradialis. Okay. Other side. Good. All reflexes are a +3 bilaterally. So the next thing I want to do is just assess your cranial nerve, number 11, with your strength and range of motion to your head and neck. So I'm going to go ahead and have you look to the window and then look to the wall. Go ahead and take your right ear down to your right shoulder and your left ear down to your left shoulder. Good. And I want you to go ahead and do that against my resistance. Go ahead and look to the window and then look to the wall. Go ahead and drop your right ear down to your right shoulder and your left ear down to your left shoulder. Good. Patient has good range of motion with good strength against resistance. So I want to ask you about feeling sharp and dull. So first things first, this feels dull. Can you feel that?
Yeah.
And this feels sharp. Okay. So what I want you to do is just tell me with your eyes closed, when you feel me touch, tell me if you feel that it's sharp or dull.
Sharp. Dull. Sharp. Dull.
Okay, let me see the other arm. Same thing, keep your your eyes closed, let me know when you feel if it's either sharp or dull.
Low, sharp, dull, sharp.
Okay. You're gonna open your eyes. So what I want you to do is just do what I do. I want you to take your hands palm side down on your thighs, and then go ahead and flip your hands the other way, and then down, palms, and then other way, and get faster and faster. Good. Now go ahead and take your finger to your thumb, and I want you to then move your different fingers to your thumb. So you're gonna do your pointer finger, your middle finger, your ring finger, your pinky finger, back and forth as fast as you can. Excellent. So the next thing I want to do is just do some strength testing and range of motion with your shoulders. You can go ahead and stand up for me. Just do what I do. We're going to go ahead and do zombie, airplane, Superman. Now take your right arm and comb your hair. Pat yourself on the back. And then throw a softball. Good. And with your left arm, go ahead and comb your hair. Pat yourself on the back. And throw a softball. Okay, I just want to assess your strength. So just go ahead and bring your hand to your head, and then bring your hand towards me. Good, and now the other side. Towards, yeah, perfect. Perfect. And then I want you to go ahead and put your arms out and lift up against me. Good, and then push down against me. Excellent. Patient has good range of motion. Strength against resistance is excellent. And do you have any questions for me today?
No, I do not.
Okay, thank you for your time.
Thank you.